So how do we reduce your heart disease risk when you have during menopause? And the idea is that as you age, you increase your risk of heart disease. It's just something that happens. And so, what are some things that we can do to reduce your risk? And with women, they have a protective mechanism up until the point where they do have menopause. And so, at that point, whatever age that might be for you women out there, is that it can happen obviously at that certain age, but then what are the changes that happen to your body? And so one of the things that was protective to you is the estrogen. And when we decrease estrogen, then it puts ourselves at risk of heart disease. And there's a few theories behind that, but I won't get into it in this video. And I disagree with some of the points as to what happens or how we find out, but why is it? And what happens is that you can increase your risk of increased cholesterol, but we know cholesterol is not what causes heart disease, and it's cholesterol being used in a negative way is what causes heart disease. And so what inflammation or oxidative stress can happen to the arterial wall? Remember, arteries are a muscle, right, not a pipe. And so what are some things that can happen to that level when you do have when you are undergoing menopause? And menopause as well is you can also increase risk of heart disease because of blood pressure changes, because of hormonal changes. And so hormonals are one of the puzzles that we look at the HeartFit Clinic. And so what are some things that you can do to reduce your risk? And so at the number one thing I always suggest is understand where your risk is. And so if you have higher risk factors to heart disease, such as high blood pressure or diabetes, overweight, what is your risk? At the end of the day, we want to know where your risk is, and that's what we do at the HeartFit Clinic. So understanding risk of looking at the artery as a muscle, not a pipe. And getting a stress test, in my opinion, is 100% waste of time in this category unless you're feeling symptoms or pains of heart disease. And so going to a cardiologist who just does stress tests, unfortunately, I'm just going to say, is not helpful at that point. And so you want to look at things before it becomes a problem. That's the subclinical disease, and that's what we focus on. As well, stay active. You want to eat well. So make sure you understand your numbers. And there's a whole thing, and I want to just quickly touch on before I let you guys go, is on hormone replacement therapy. And it can be found, there's studies that show, okay, it increases risk, or HRT, hormone replacement therapy, can increase risk or can decrease risk or be helpful. And I think this is where it becomes very important to make sure you seek a good hormone specialist, an endocrinologist, or a good hormone specialist who understands a functional medicine aspect of as to why hormone replacement therapy might be good for you. So we could talk so long about different things. Again, I just want to keep these quick clips. How to reduce your risk of heart disease during menopause. These are some quick tips to help you out. Make sure you hit subscribe above, share some comments, feedback, and I look forward to helping you live happier, healthier, and longer.